following demonstration shows how to give a reflexology treatment using the method taught by the Bailey School of Reflexology. The treatment is being given by Nicola Hall, Director of the Bailey School, and the client being treated is Maureen Androlia. Reflexology is based on the principle that there are reflex areas in the feet that correspond to the different parts of the body, with the whole body being represented in the 2 feet. The right foot corresponds to the right side of the body and the left foot corresponds to the left side of the body. The arrangement of the reflex areas is determined by a series of 10 longitudinal zones, first described by an American, Dr. William Fitzgerald. Whichever zone or zones of the body an organ is found in, there will be a corresponding reflex area in the same zone or zones of the feet. Another set of zones helpful in determining the position of the reflex areas are transverse zones. These relate to the level of the shoulder girdle, diaphragm, waist and pelvic floor. Waist level is found approximately halfway down the foot and can be identified by feeling for a bony projection on the outer side of the foot. Parts of the body situated above the waist will be represented above waist level in the foot. Parts of the body situated below the waist will be represented below waist level in the foot. The client will ideally be seated in a comfortable reclining position with the legs raised and the knees bent to ensure that the feet are relaxed. Also, the feet need to be raised to a height that will be comfortable for the practitioner to work on them. The precise technique that is used to give reflexology treatment is very important. This involves using the thumb to work precisely on the reflex points. The thumb is held bent and pressure is applied using the side and tip of the thumb. The pressure is held on the point for a moment or so and then released, and then pressure applied to the next point just fractions along from where you've already applied pressure. The whole time the thumb is held bent, so there's no bending or straightening in between each time pressure is applied. And as much as possible when working an area, the thumb would be kept in contact with the foot. When pressure is applied to the different reflex areas, the patient will experience different sensations. Sometimes they will just be aware of pressure being applied to the foot. Sometimes the pressure may feel heavier, even though it's not, and slightly more discomfort will be felt. It might even feel quite sharp, a bit like a fingernail or a bit of glass being stuck into the foot. In other areas it might feel like a bit of bone moving around beneath the skin surface or a bit of gristle. These different degrees of discomfort or sensations felt by the patient indicate to the practitioner how out of balance the corresponding parts of the body are. Talcum powder is used on the feet to apply the reflexology treatment. Talc is the best medium to work with. If the feet are a little bit moist, it will absorb some of the moisture in the foot. If the feet are rather dry, then it will give a smooth covering over the dry patches. It also enables you to work more accurately on the reflex points. As you apply the talc, apply a bit of general massage to the foot to enable the patient to get used to you touching their feet. It will also help to warm up the feet if the feet are a bit cold, and it will also start to help the patient to relax. Treatment will be given to the right foot first. So firstly, the pituitary reflex in the centre of the big toe. Use the right thumb, apply pressure to the very centre of the big toe, use the left thumb to support the tip of the toe. Then, having worked that centre point, fill in the whole area around that centre point in the middle third of the toe. And this will all relate to the centre of the brain. Then the neck reflex at the base of the big toe. With your right thumb, start on the inner side of the foot and work across just above where the toe attaches to the foot. Again, supporting the tip of the toe with the left hand. Then up the side of the big toe for the side of the head, the side of the brain. So still using the right thumb, work from the base of the toe up to the tip. Then change hands and work over the top of the big toe for the reflex to the top of the head, top of the brain. and then work that same area but a little bit lower down on the toe, which will also relate to the top of the head. Then the spine reflex down the inner side of the foot. So using the left thumb, with your thumb pointing in a forward direction, start along the edge of the big toe and follow the arch of the foot down the side of the foot, and that will all relate to the spine. We'll finish up with the base of the spine, which is about 1/2 inch in front of the back of the heel. Then you'll change hands and come back up the side of the foot, this time following a straighter line up the side of the foot. So pop the fingers of the right hand underneath the back of the heel, work with your right thumb, working in a forward direction all the way up the side of the foot, and that too will relate to the spine. Once you get to about waist level up the side of the foot, bring the fingers round, rest them on the top of the foot, and then you can continue working straight up the side. Use the left hand to support the big toe as you're working. So after the spine reflex in the side of the foot, then the reflex to the face on the upper aspect of the big toe. So finger pressure is used to work the face reflex. Work from the base of the toe up to just below the nail, and use as many movements as is necessary to cover the whole area. Then the reflexes to the sinuses in the small toes. So each toe in turn has got to be worked on. Support the tip of the toe with the left hand. Work with your right thumb, working from the base of the toe right up to the tip. And then you need to work the sides of each toe as well. So use the left thumb to work up the inner side of the toe, and then use the right thumb to work up the outer side. And then the third toe. So you'll need to keep changing the position of your hands in order to be able to comfortably work the reflexes for the sinuses. If the toes were very plump, you might need to make more than one movement up the back of the toe, particularly if you've got little fingers. When you've worked the backs and sides of the toes, you then need to work the fronts of the toes for the teeth and gums. So again, use finger pressure to work from the base of the toe up to just below the nail. One movement should be sufficient, but if the toes were quite plump, then you might need to make more than one movement. Then the reflex for the eye, found just beneath the second and third toes. So use your right thumb, working just below where those two toes attach to the foot. The reflex for the eustachian tube, just below the web between the third and fourth toes. And then the reflex for the ear, just beneath the fourth and fifth toes. So use the left hand to just straighten out the toes slightly. Use your right thumb to work just below where those toes attach to the foot. Then the shoulder reflex. The shoulder reflex is found around the base of the little toe, so on the sole of the foot, the side of the foot, and slightly on the top of the foot. So work the sole of the foot first, just around where the little toe attaches to the foot. Then work the side and top of the foot around the base of the little toe, and then come down the side of the foot for the reflex to the arm using the left thumb. Work down until you reach the bony projection about halfway down the foot, and actually over that area will be the reflex for the elbow. Then turn your hand round and come back up the side of the foot a little bit higher than you worked down, and that will relate also to the arm. Then back to the sole of the foot and the reflex for the thyroid gland. So this is found over the ball of the big toe. Use your right thumb starting on the inner side of the foot. Use the left hand just to support the tip of the toe. Follow an L-shaped pattern, tighten beneath the ball of the big toe and then straight up the side of the ball of the big toe. And as you make that first movement, you will also overlap the reflexes for the parathyroid gland. So the first reflex is just as you turn the corner, coming up round the side of the big toe. And then the upper parathyroid reflex is just below the web between the first and second toe. Then you repeat that movement to fill in the whole area over the ball of the big toe, which will all relate to the thyroid gland. So use your right thumb for that movement. Then the lung reflex on the right foot. Start in zone 2 beneath the second toe over the ball of the foot. Use your right thumb, work across from zone 2 to zone 5. Then change hands and come back across with the left hand from zone 5 to zone 2. And then keep changing hands and moving back across the whole area. And the number of movements will depend entirely on the size of the foot. So you need to cover the whole area over the ball of the foot. And that will all relate to the lung. Then the area for the solar plexus. So this you find just below diaphragm level in the foot, and diaphragm level is just below the arch of the foot. And in many feet you find quite a change in coloration between the yellowy, reddy area of the upper part of the foot and the paler skin below the arch. So across the arch of the foot is the level of the diaphragm. The solar plexus reflex is just below diaphragm level, mainly in zone 2 and then also a little bit in zone 1, maybe even zone 3. Then the areas found between diaphragm level and waist level in the foot. So on the right foot there is the reflex for the liver. So start with your left thumb just below diaphragm level in zone 5 and work across with your left thumb right the way across to zone 1. When you get to the other side of the foot, change hands and come back again, a little bit lower than you worked the first time. Then change hands and work back across towards zone 1, but go just a little less far with each of those movements because the liver reflex occupies a triangular shape on the foot between diaphragm and waist level. The bulk of the liver reflex is in zones 5, 4 and 3 and just the upper part of zones 1 and 2. Then the gallbladder reflex, which you find just below the liver reflex and just above waist level in zone 3. It's almost the very centre point in the foot. Use your right thumb to just press on that precise area. Then the rest of the area between diaphragm and waist level relates to the stomach and also to the pancreas. The stomach reflex you find in zone 1, and then the pancreas reflex you find in zones 1 and 2, but the lower half of the area. But it will be overlapped by the stomach reflex in that lower part. So use your right thumb, starting just below diaphragm level, work across, filling in zone 1, And then as you get a little lower down, work across also into zone 2. So that will relate to the pancreas. Then the area for the small intestine. So this you find from waist level down to the area above the pad of the heel, zones 1, 2, 3 and 4. So start in zone 1 with the right thumb, work across at waist level. When you get to zone 4, change hands and come back with the left thumb across to zone 1, a little bit lower than you worked the first time. And then just keep repeating those movements until you've filled in the whole area between waist level and the pad of the heel, and that whole area will relate to the small intestine. Finish on the outer side of the sole, just above the pad of the heel, bit in zone 4, zone 5, and the reflex for the ileocecal valve. So use your right thumb, apply pressure to the reflex, to the ileocecal valve, and then work up in a straight line up the reflex for the ascending colon. Then when you get to waist level, change hands and come across at waist level using the left thumb, and you'll be working the area for the transverse colon, just the first half of that area, with the other half being found on the left foot. Then the bladder reflex. The bladder reflex you find on the inner border of the foot, just above the pad of the heel. Very often there's a slight puffy area on the side of the foot, and that nicely marks the spot for the bladder reflex. So work that with the right thumb. You place the fingers of the right hand just slightly underneath the back of the heel and work the side of the foot for the bladder area. You may also work a little bit on the sole of the foot for the bladder reflex, so that that reflex is capping around the inner margin of the foot. Then with the right thumb, work upwards and out towards the kidney reflex. So you'll need to bring the fingers of the right hand round to rest on the top of the foot. Use the left hand just to mark the level of waist level, so feeling for the bony projection on the side of the foot. And with the right thumb, work up the ureter tube reflex, across to zone 2 at waist level, which will be the area for the kidney, and the kidney will also extend into zone 3, a little bit below waist level and also a little bit above waist level. Then just above the kidney reflex is the reflex for the adrenal gland. So that is found in zone 2, but on the side closest to zone 1. And you will work that with the right thumb. Then the area for the sciatic nerve. This you find about a third of the way down across the pad of the heel. This can sometimes be quite a tough area on the foot, so you may need to apply a little bit more pressure in that area. Use your right thumb to work across from your right to your left, or you could use your left thumb to work across from your left to your right. Then, having worked that one precise area, fill in the rest of the area over the pad of the heel, and that will all relate to the pelvic region. So again, it doesn't matter whether you use the right thumb or the left thumb, as long as you're working in a forward direction. And you want to make sure you cover the entire area. Having worked the sciatic nerve on the sole of the foot, you then need to work up the sides of the foot and up the back of the leg. So the continuation of the sciatic nerve, place the third finger at the level of the sciatic nerve reflex on each side of the foot. Then working with the finger, just press on the side of the foot, taking the shortest distance to the back of the heel, and then working up the back of the leg for 3 or 4 inches, just pressing on either side of the Achilles tendon, and then a pinching action coming down the back of the leg. Try not to lift the foot up too high as you do that. Then onto the outer margin of the foot, and firstly the reflex for the sacroiliac joint. That you find in a little dip just in front of the outer ankle bone, about in line with the 3rd, 4th toe. So if you just press on that one reflex, and then work underneath the outer ankle bone in a half circle, coming round to join to that sacroiliac point, and then work again just a little bit lower than you worked the first time, and that will all relate to the pelvic muscles. Then the areas for the knee and the hip on the side of the foot. So in the area from waist level to the back of the heel, divide that into 2 and imagine a large half moon shape on the side of the foot which you're going to fill in. So working with the left thumb, working at right angles to the side of the foot, just fill in those half moon shapes. So the first one just below waist level relates to the knee, and that also will include the lower leg. And then the second one nearer to the back of the heel will relate to the hip and also the upper leg. Then the reflexes for the reproductive glands. So on the outer margin of the foot, the reflex for the ovary. So halfway between the tip of the ankle bone and the very back of the heel, a point on the outer margin for the ovary reflex in the female, testis in the male. A similar point on the inner border of the foot, halfway between the tip of the ankle bone and the back of the heel, relates to the uterus in the female or the prostate gland in the male. And again, finger pressure or thumb pressure. And then joining those two over the top of the foot in front of the ankle bones, the area for the fallopian tube in the female or the vas deferens in the male. So you can use your thumb to work from one side over the top round to the other side. That may be slightly uncomfortable if you're sitting quite low, so it might be more comfortable to use finger pressure. So start with your 3rd finger on the sides of the feet and just let the hands meet on the top of the foot and then work down again on that same precise area. Then the lymphatic reflexes on the upper aspect of the foot. The reflexes to the lymphatic system are found on the top of the foot. So start at the roots of the toes and work down to cover the whole area on the top of the foot. So you can use finger pressure, 1 finger, 2 fingers, 3 fingers, it doesn't really matter. Could use thumb pressure if you were sitting quite high in relation to the foot, but in order to be comfortable to work the sole of the foot, you'll probably find you need to work with your fingers on the top of the foot. As you work down at the roots of the toes, that relates to the upper lymph nodes, and then you work down through the thoracic region, the abdominal region, and then the pelvic region. So having worked all of the area on the top of the foot, then go down, work over and around the ankle bones to complete the lymph system with the reflexes for the pelvic lymphatics and groin lymphatics. A pinching action between the big toe and the second toe relates to the lymph drainage point. Then, before moving on to the left foot, do the exercises to the foot. So firstly, rotation of the toes. Support the base of the toe. So with the big toe, support with the right hand around the base. Hold the toe near to where it attaches to the foot with the left hand. And just rotate the toe round a few times in one direction and then a few times in the other direction. And then rotate each toe in turn. If you've got quite big hands, you can probably still be supporting each toe joint, holding in that way. If it's quite a big foot and you've got a small hand, then you may need to change your grip, support with the left hand and rotate the toes around with the right hand. Then a ringing action. So place the fingers on the top of the foot and the thumbs underneath. Have the left hand around the little toe, the other hand beneath. And just ring the hands away from each other. It's like spreading out the bones in the foot, giving some breadth to the foot. Then the kneading action. So using the flat surface of a clenched fist, press up at diaphragm level, place the other hand flat on the top of the foot, and then press those hands against each other and at the same time rotate the hands round. And then ankle rotation. So place the left hand just underneath the back of the heel, hold on to the ends of the toes with the right hand, then just ease the ankle joint round a few times in one direction and then a few times in the other direction. And you want to make sure that it's you, the practitioner, moving the ankle joint round, not the patient. Then the right foot is finished and it's on to the left foot. So the first reflex is that to the pituitary. So in the centre of the big toe, work with the left thumb, support the tip of the toe with the right hand, work that very centre point and then an area all around that centre point, which will all relate to the centre of the brain. Then the reflex for the neck. So just above where the toe attaches to the foot, use your left thumb, work across that area, still supporting the tip of the toe with the right hand. And then the area for the side of the head, the side of the brain, up the side of the big toe. Then change hands and use the right thumb to work over the top of the big toe, for the top of the head, top of the brain. And again, repeat that movement a little lower down so that you fill in the whole area in the top third of the toe. Then the area for the spine, so use your right thumb to work down the spine reflex. So starting along the side of the big toe, about level with the base of the nail, use your right thumb pointing in a forward direction, following the arch of the foot. Just use the other hand to support where you work, just by where you're working. And you come down to about half an inch in front of the back of the heel, where you'll finish with the reflex for the coccyx. Then change hands. Use your left hand to come back up the spine. This time you'll follow a slightly straighter line up the side of the foot. So just rest the heel in the palm of the hand and work with the left thumb, working up the side of the foot until you get to about waist level. You probably won't be able to stretch much further. Bring the fingers round to rest on the top of the foot so you can then continue working up the spine reflex using your left thumb. Work all the way up to just about level with the base of the nail. Then the reflex to the face on the upper aspect of the big toe. Finger pressure is sufficient for that, so work from the base of the toe to just up below the nail on the upper aspect of the foot. And then the sinus reflexes in the smaller toes. So use the left hand to support the very tip of the toe, straighten the toe out slightly, and then use the right thumb to work from the base up to the tip of the toe. Then you need to work up the sides of the toe, so use the right thumb to work up the inner side of the toe, and then change hands and use the left thumb to work up the outer side. And then do each toe in turn using a similar pattern, so working up the back of the toe first, then up the inner side with the right thumb, and then using the left thumb to work up the outer side. And at all times you want to be supporting the toe with the hand that isn't being used to apply pressure. Then after the reflexes to the sinuses, the reflexes to the teeth and gums, which you find on the upper aspect of the toes. So use finger pressure, work from the base of the toe to just up below the nail. One movement should be sufficient unless the toes are a little bit plump or you've got very narrow fingers. Then the reflex for the eye. So support the second and third toes at the tip, straighten them out slightly, and then work with the left thumb just below where those toes attach to the foot, working from zone 2 to zone 3. Then the reflex for the eustachian tube, so just below where the web between the third and fourth toe. It's one precise point. And then the reflex for the ear, so support the fourth and fifth toes, work with the left thumb just below where those toes attach to the foot. Then the shoulder reflex, so on the sole of the foot around the base of the little toe and also on the side of the foot. So work the sole of the foot first, and then with your right thumb work around the base of the little toe on the side and on the top of the foot. Then work along the outer edge of the foot until you reach the bony projection about halfway down the foot. So you'll have worked down the arm reflex to the elbow reflex over the bony projection. Then come back up the foot a little bit higher than you worked down. So use your right thumb and work along the outer edge to just below the little toe, and that too will relate to the arm. Then the thyroid reflex on the sole of the foot, so over the ball of the big toe. Use your left thumb to apply the massage. Use the right hand just to support the toes. We're going to follow a backward L-shaped pattern around the ball of the big toe on this foot, so starting at the side of the foot, tighten beneath the ball of the big toe and then up the side of the ball of the big toe. And with that first movement you'll also overlap the parathyroid reflexes. So the lower parathyroid reflexes just as you turn the corner to come up the side of the ball of the big toe, and then the upper parathyroid reflex is just below the web between the big toe and the second toe. Then using that same backward L-shaped pattern, fill in the entire area over the ball of the big toe using the left thumb, and that will all relate to the thyroid gland. Then the lung reflex over the ball of the foot, and also in the left foot there's a reflex to the heart in the lower part of this area in zones 2 and 3, possibly also zone 1. So start in zone 2 using your left thumb just below where the toes join the foot, and work straight across from zone 2 to zone 5. Then come back again a little bit lower than you worked the first time using your right thumb to come across from zone 5 to zone 2. And then just keep repeating that movement, changing hands so that you're working in a forward direction. And then in the lower part of the area, just work zones 5 and 4 for the lung, so that you work the heart reflex as a separate area. So having worked the lung area, then work the heart reflex in zones 2 and 3, using the right thumb to go across from zone 3 to zone 2, and possibly also due to its zone position, the reflex might be found in zone 1. So fill that whole area in. Then the area for the solar plexus. So this is found just below diaphragm level in the foot. So diaphragm level just below the arch of the foot, and the solar plexus reflex in zone 2, maybe also extending a little into zone 3, maybe also in zone 1 as well. The main area for the solar plexus is zone 2. You can use your left thumb or you could use your right thumb on that, it doesn't really matter. Then the areas in the left foot between diaphragm level, below the ball of the foot, and above waist level. So feel for waist level by feeling for the bony projection on the outer margin of the foot. And firstly, the area for the spleen. So this you find in zones 4 and 5 on the left foot. So use your right thumb, work from zone 5 to zone 4, just below diaphragm level, and then repeat that movement, just working a little bit lower down with each movement. Then the rest of the area between diaphragm and waist level relates to the stomach, and then in the lower half also to the pancreas. So use your left thumb to start in zone 1, just below diaphragm level, work across to zone 3, change hands, come back again, a little bit lower than you worked the first time, and then just keep repeating that movement, going backwards and forwards until you've filled in the whole area between diaphragm and waist level. And in the lower half, that will also relate to the pancreas in zones 1, 2 and 3. Then at the area for the small intestine, so from waist level down to above the pad of the heel. So zones 1, 2, 3 and 4. Start with the left thumb in zone 1, work across at waist level to zone 4. Change hands, come back again a little bit lower than you worked the first time, from zone 4 to zone 1, and just keep going backwards and forwards to fill in the whole area that relates to the small intestine. Then the area for the large intestine on the left foot, so back up to waist level using the left thumb, work across all the zones at waist level, and that will be the continuation of the transverse colon. Then change hands, and with the right thumb come down in a straight line, bit in zone 4, bit in zone 5, for the area for the descending colon, and that will finish just above the pad of the heel. And then with the right thumb, come back across all the zones just above the pad of the heel, which will relate to the sigmoid colon. And that reflex will end with the reflex to the rectum on the inner border of the foot. Then the bladder area. So just above the pad of the heel, on the inner side of the foot, slight puffy areas often present there, which marks the position of the bladder reflex. Work with the left thumb, place the fingers of the left hand just underneath the back of the heel. So work the bladder area on the inner margin of the foot, a little bit on the side, a little bit also underneath on the sole of the foot. Then bring the fingers round to rest on the top of the foot and work up the ureter tube reflex, going across zone 1 up to zone 2 at waist level for the kidney reflex, and the kidney reflex will also be found in zone 3, a little bit above waist level and a little bit below waist level. And then just above the kidney reflex in zone 2, just above waist level, but on the edge of zone 2 closest to zone 1, the area for the adrenal gland. Then the reflex for the sciatic nerve, so a third of the way down the pad of the heel. So working either with your right thumb from your right to your left, or with your left thumb from your left to your right. And then repeat that movement to fill in the whole area over the pad of the heel, in this slightly tougher part of the foot, which will all relate to the pelvic region. Then, having worked the pad of the heel, you need to work the continuation of the reflex for the sciatic nerve, which is going to go across the sides of the foot and up the back of the leg. So place the third finger on the side of the foot at the edge of the sciatic reflex. Take the shortest distance to the back of the heel, and then just work up the back of the leg on either side of the Achilles tendon. Finish off with the pinching action down the back of the leg for the sciatic nerve, and then onto the outer margin of the foot. Firstly, the reflex for the sacroiliac joint, which you'll find just in front of the outer ankle bone, a little dip about in line with the third, fourth toes. Use finger pressure or work with your thumb, and then working just below the outer ankle bone, sort of half circle shape, coming round from the back to join to that sacroiliac point. That will all relate to the pelvic muscles. Then the area from the base of the bony projection to the back of the heel, divide that into two large half moon shapes on the outer side of the foot, and filling in those areas will relate to the reflexes for the knee and the hip. So firstly, the half moon shape just below waist level relates to the knee reflex, and that will also include the lower leg. So use your right thumb to work at right angles to the side of the foot, and then the half moon shape nearer to the back of the heel, that will relate to the hip and also to the upper leg. So again, you fill that in by working at right angles to the side of the foot. Then the areas for the reproductive glands, so halfway between the tip of the ankle bone and the back of the heel, the area for the ovary on the outer side of the foot, the reflex for testis in the male. Similar position on the inner side of the foot, halfway between tip of ankle bone and back of heel, reflex to the uterus in the female, prostate gland in the male. And then joining those two over the top of the foot, just in front of the ankle bones, the area for the fallopian tube in the female, the vas deferens in the male. You can use thumb pressure, or you might prefer to use finger pressure to work that area because it's slightly more comfortable. Then the lymphatic reflexes on the upper aspect of the foot. So start at the roots of the toes, work down using finger pressure, working in a straight line all the way down to over the ankle bones, and you can apply pressure with one finger or two fingers, 3 fingers, it doesn't really matter. Probably wouldn't use thumb pressure because if you're sitting at a comfortable height to work the sole of the foot, you're probably sitting a little bit low to work the top of the foot with your thumb. So start in line below the web between each of the toes. As you work at the roots of the toes, that relates to the upper lymph nodes, and then you work your way down through the thoracic lymphatic, then the abdominal lymphatics, and then over the ankle bones, the pelvic lymphatics and the lymph of the groin. So you'd go over the top of the ankle bones and around the ankle bones. And then the lymph drainage point, the pinching action between the big toe and the second toe. Then the exercises to the foot. So firstly, the toe rotation. So support the base of the big toe with the left hand around the joint where the toe attaches to the foot. And then with the right hand, hold from above and holding near to the very base of the toe. Ease the toe around a few times in one direction and then a few times in the other direction. And then rotate each toe in turn. And if necessary, change your support for the outer toes and then rotate with the other hand. Then the ringing action. So the fingers resting on the top of the foot, thumbs underneath. Spread the hands apart, like spreading out the bones in the foot, so broadening the foot. And then the kneading action, using the flat surface of a clenched fist pressed up at diaphragm level, other hand flat on top of the foot. Press the hands against each other and at the same time just rotate them round. And then the ankle rotation. Place the left hand just underneath the heel, just rest the heel in the hand, don't grip tightly. Use the right hand to just hold on to the toes, and then you're just going to ease the ankle round a few times in one direction and then a few times in the other direction. And making sure that you, the practitioner, are moving the ankle around, not the patient. Then you've worked all the points in both feet, and the very final part of the treatment will be the solar plexus breathing exercise. So place the thumb on the solar plexus reflex in each foot, just rest the fingers on the top of the foot. As the patient breathes in, you're going to apply pressure to the solar plexus reflex and ease the feet up towards the patient. Then as they breathe out, you'll ease the pressure off the reflex and just ease the feet down towards you. And that you'll repeat 3 or 4 times at the end of the treatment. So if you'd like to take a deep breath in, ease the feet up towards the person, and then ease the feet out downwards as they breathe out. And then breathe in. Keep your thumbs in contact with the solar plexus reflex, even as you ease the pressure off. And once more. And that is the full treatment. At the end of a treatment session, the practitioner will rework the important reflex areas for the client. These will include reflex areas that appeared tender during the treatment, or those which are known to be important for the particular conditions present. A full reflexology treatment session will last for about 1 hour. Reflexology is a very relaxing form of treatment and is also a means of treating a wide range of different disorders.